facilitator and all the HOD department. It's me, Anisha Chaudhary, representing Group A of this PBL session. And today I am going to give presentation on osteomyelitis. Osteomyelitis, osteo means bone and myelo means bone marrow and itis means inflammation. So osteomyelitis is the inflammation of bone and bone marrow caused by microorganism. It is always second to the infection. The complication of systemic infection. It manifests primarily solitary focus of the disease and there occurs necrosis of bone cells and bone marrow. The common osteomyelitis is caused by all the microorganisms such as virus, bacteria, parasites, fungi. But the most common cause are the pyogenic bacteria and mycobacteria. Pyogenic osteomyelitis is caused by bacterial infection and the most common cause is Staphylococcus aureus, which is responsible for 80 to 90% of pyogenic osteomyelitis. In neonates, osteomyelitis causes epiphyseal infection which results in septic arthritis and articular cartilage destruction. In children, osteomyelitis is hematogenous and in origin and common in long bones. In long bones such as lower femoral metaphysis, upper end of tibia and distal end of tibia and upper end of humerus. Hematogenous osteomyelitis is acute infection. In adult, osteomyelitis is originated from compound fractures, surgical infections, diabetes, as well as extension from contagious sites, which leads to infection of feet. Mycobacterial osteomyelitis is more chronic than pyogenic osteomyelitis because it causes resistance to the treatment. The spine is involved in 40% of mycobacterial osteomyelitis. Mycobacterial osteomyelitis is the infection which spreads through the intervertebral disc to multiple vertebrae and surrounding soft tissues. Here is the vertebra and the infection occurs in the intervertebral disc. So the epidemiology of osteomyelitis. In children, the most common route for osteomyelitis is hematogenous route, and in elder adults, it occurs through bone surgeries, diabetes, UTIs. Because of these sites, there is most common cause of infection. Males suffer more from osteomyelitis than female because males are more common to the traumatic due to sports and other causes. It is also more common in children than children, especially boys, because there is the hairpin-like arrangement in the femur, of the femur, where there is the stasis of blood or slowness of blood, which causes increased chances of infection, which leads to osteomyelitis. The most common sites of bones affected are long bones, especially femur, tibia, humerus. Causative agent as per is. In neonates, the most common causes are group B streptococci as well as E. coli is caused. In children, gram-positive bacteria are the common cause of the osteomyelitis, such as Staphylococcus aureus, Streptococcus pyogenes, etc. In adults, most common causes is Staphylococcus aureus, as I said earlier, and other pathogens are Salmonella, Streptococcus species, Klebsiella, Mycobacterium tuberculosis. Salmonella is the causative agent of osteomyelitis even in the patients who already have sickle cell anemia. Some of the risk factors of osteomyelitis are trauma. From these sites, infection can be easily occurred. Trauma in the open fractures, malnutrition, infection, poor immunity, diabetes, and delayed care. Ignorance, poor access to specialized health services. The sites of osteomyelitis are distal metaphyseal end of femur, proximal metaphyseal end of tibia, proximal end of humerus, and body. vertebra. The most common site of osteomyelitis is lower femoral metaphysis, and the second most common cause is distal end of tibia, and we can say third as the upper end of humerus. Sites of infection. Osseous vascular circulation varies with age. In neonates, infection of metaphysis, epiphysis, or both. Metaphyseal plates of the vessels causes more common sites for the neonates to cause osteomyelitis. In children, the infection of metaphysis of long bones. In adults, epiphysis and soft control regions are infected. These are our references. And thank you so much for your precious time. And you are free to ask any queries. Our teams are ready for the answers.